Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, the answer company. The division championship Minnesota Twins are looking to go all the way to the World Series in 2024. Bolstered by inspirational shortstop Carlos Correa, a healthy Brian Buxton, and rookie phenom Royce Lewis, plus a pitching staff led by Pablo Lopez and an outstanding bullpen featuring Johan Duran, the Twins are the best bargain in the major leagues, and Target Field is the best venue in baseball. Sheridan Dulas & Kins, PA, a family and criminal defense law firm, has been serving clients in Dakota County and throughout Minnesota for over 40 years. Ranked a Tier 1 Best Law Firm by U.S. News and World Report every year since 2009, Sheridan Dulas & Kins are here to help you in your most difficult life circumstances. Established in 2007, 45th Parallel Spirits was among the first 50 microdistilleries in the United States. Based in New Richmond, Wisconsin, all aspects of production occur at our facility. If you're interested in visiting and learning more about the 45th Parallel Distillery, please check our website and plan a visit to tour our facility and taste our spirits. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org.
Welcome to another episode of Access to Democracy. I'm your host, Steve Francisco. It's my pleasure to welcome to our studio today two of our state representatives from the 52nd District, the 52A representative, Liz Reyer, and 52B, newly elected representative, Bianca Virnig. Liz and Bianca, welcome to Access to Democracy.
Thank you so much.
Thanks for having us.
Good to have you. So this was a really amazing session in terms of the volume of legislation that was taken up this year, and also the fact that we have so-called unified state government where both houses of the legislature were in the hands of the DFL, albeit by a narrow majority in the Senate and the House, and we have the governorship. So there was really, if you will, no excuse not to get a lot done this year, wouldn't you say?
I think so, and I think we really came through. If you look at 2 years together, in particular, in 2023, when we had the budget year, we were able to pass major legislation that we'd been working on in the House for many biennia, but with divided government we couldn't pass. This year is a policy and bonding year. We didn't actually spend very much money, but we made important changes in policy across the field: education, healthcare, transportation. Really, I think ways that we were able to help the people of Minnesota.
And Bianca, would you agree?
Oh, I would, yes, very much so agree. As you know, I came in halfway through the biennium and I had a blast. So
right, we should tell people too, you were elected in a special election, right?
Yes,
Because the previous representative, Liz Richardson, resigned.
Ruth
Ruth Richardson resigned her seat to take over as executive director of Planned Parenthood, right? So,
yes, yep. Yeah, so I was on the 196 school board and ran in a special election, was elected, and started sworn in January, started in February, and it was, I just felt like I hit the ground running and got a lot. Personally, I felt like I got a lot done, and watching it for the first time, coming in midstream, in a class of your own, right? It seemed like we got a lot done.
So tell our viewers briefly, what are the rough geographic boundaries of your district? You represent 52B.
Yep.
Roughly what community does that include, communities?
So the north half of Eagan, and then Mendota Heights and Mendota. So kind of Cliff North, and then the east side.
Right.
portion of Egan.
And Bianca, what committees did you serve on in the legislature?
I had the best committees. It was so great. I was on the Elections Committee, the Human Service Finance Committee, and the Ed Finance Committee. They were great. It was perfect for me.
We have some say on elections, don't we? Because isn't Senator Carlson,
Yes,
who
yeah,
represents
yeah.
52 in the Minnesota Senate, is chair of the Elections Committee in the Minnesota Senate.
And I got the unique opportunity of being appointed to the conference committee, the Elections Conference Committee. So that was fun. You know, you go into that meeting and there's your senator, and I got to be there and be part of that process. And my first term was really awesome. So,
Good.
yeah.
And Liz, describe what are the boundaries of your district, the 52A portion?
I have essentially southwestern Egan and the northern part of Burnsville.
Okay. And what committees did you serve on?
Well, I'm going to have to argue with Bianca because I really have the best committees. I'm Vice Chair of Capital Investment. I'm on the Health, Finance, and Policy Committee for the 4 years in a row now, and then Economic Development and Workforce Development.
Very good. So let's turn to, we'd like to touch on several issues here. I know time always runs short, but let's jump right into it. Education. What happened with education this year at the legislature?
Sure. So the first half of the biennium, they passed the READ Act. So they had READ Act 1.0, and that was to help districts improve their literacy programming and bring students up to, it's huge. It's a really big piece in education. For example, I'm a parent of a student with dyslexia, and this will help address some of the deficiencies in schools and the system and the structure itself, so kids can come up to grade level for reading. And this session, they passed READ Act 2.0, and that addresses some stipends around the teacher prep programming. There's just a whole lot. It was sort of, I would say, like a cleanup of the READ Act 1.0. How can you remember that operationalizing piece, what looks like a good idea, and then you start to think about it and go, oh, we need to tweak it a little bit. There was some investment in absenteeism. You know, absenteeism is a huge issue.
Trying to reduce absenteeism, right?
Yep. How
right.
can we improve attendance for students? And I had a really fun bill, 2 little quirky bills for school nurses, and one allows the LPN to administer an EpiPen without having to call the nurse first.
And an LPN is a
licensed practical nurse.
Right.
And, you know, the nurse, of course, the licensed school nurse is always at her desk waiting for the phone to call to say, yeah, you can give that EpiPen. And one of the other things that we brought up, that I tried to bring up frequently, was around critical infrastructure in schools. You know, we've had these investments in teachers and the unemployment insurance and earn safe and sick time and curriculum, but we've forgotten about the buildings as it relates to schools. And there's a huge disparity between the richest schools and those that are held to a cap where they've got leaky roofs and things like that. So we didn't make progress, but we started planting the seed for the future.
Are those some things that could have been helped if the legislature had passed a bonding bill too? Would that have helped with school construction?
No,
Not really. That's a separate
not really.
fund?
Yeah,
Okay.
yeah, separate
Okay.
enough.
And how about with higher education? I understand some things were done there. Tuition freeze at Minnesota state colleges, free tuition at state colleges for families that make less than $80,000 a year. Is that correct?
Yeah, yep, that is correct. So higher ed is a different committee than the Ed Finance Committee that I was on, but yeah, you are correct.
Okay.
Another thing that happened in higher ed was we passed last year guaranteed higher education for kids coming out of foster care. And that fund was so needed it ran out, and so we filled that fund so that we wouldn't cut off the kids who were getting these opportunities after having a pretty rough start in life.
Yeah, very important. How about on health care? You know, this is an issue that every year is of great concern to Minnesotans, especially for people who see their prescription drug prices going up. We have a lot of seniors. Our population in our district across Minnesota and across the country is aging as the baby boomers are retiring. What got done on health care this year?
You know, we had a pretty small budget that we used really well. One of the things that stands out to me is when you think about people who need prosthetics, the way the rules had been set up, they were getting pretty basic medical equipment. And so we had a young boy and talking about the difference that this higher end, more advanced prosthetic made in his leg. He could run, he could do sports, he could do all these things. And we passed legislation so that people could get what medical science can provide for them. We made sure that it was available to them by requiring it to be covered and then providing the funding for the public programs. So that was one important piece, and there are a number of other, I think of those as quality of life.
Yes.
Wigs for people who have lost their hair due to cancer, that type of thing. We did a lot with prescription drugs. We have the Prescription Drug Affordability Board, and that's been getting staffed up and running. And I really like that they've included, for example, a representative from the small business community, representative from the large business community, the Rare Disease Advisory Council. It's a very robust working group, and so I think that will serve us well.
And that's what the Prescription Drug Affordability Board will be doing, is looking at ways to try to contain some of those costs. And I understand there was also a reduction in, drug costs, trying to reduce drug costs and cap co-payments for prescription drugs too. So that's really, really important, especially for people that are dealing with chronic diseases such as diabetes or asthma or other illnesses. Really important.
And just this week, the Department of Health came out with a new report listing what they're calling drugs of interest that appear to be overpriced for in comparison to other locations and other drugs. So that will be interesting to watch to see how that information gets used by the board.
And the legislature this session also passed some medical debt reform legislation, very important. Can you give us a quick synopsis of what happened on medical debt reform?
Yeah, the Minnesota Debt Fairness Act does a lot to help people in Minnesota who are experiencing high medical debt, but also improves their experience with consumer debt more generally. So in medical debt, some notable things: people can no longer be denied care, routine care, care for chronic conditions if they have medical debt. And this was happening. Medical records were being locked down, so doctors and nurses and schedulers could not see their patients. So imagine a kid with asthma who couldn't get their routine care because of this. They're going to end up in the emergency room. They're going to have to
and it's going to end up costing a lot more money.
Yes, so much more. And that kid's quality of life and ongoing health is affected. Someone with congestive heart failure, all of the routine things that we take for granted to be able to see our doctors, people can now count on it. Spouses, when they lose their partner through death, will no longer be able to be held accountable for the medical debt. And that was a very interesting carve-out in state law, because the surviving spouse was not required to repay debt for anything except medical debt. So we took out that exception. There are many more things, but it's legislation I'm really proud of. Very
interesting. And I understand there's a new law curbing what's called prior authorization, where you have to go to your insurance company. And the reform, as I understand it, keeps insurance companies out of the business of trying to limit the relationship between doctors and patients in terms of, making prescriptions and providing care for them. And doesn't that make sense after all? I mean, that should be between patients and their doctor, not the insurance company.
Absolutely, absolutely. And what we did this year was take the pieces, the types of procedures that were typically overturned. They asked for a prior authorization, it would be denied 95% of the time or more. These specific procedures were then say, oh, okay, you can do that. And so why have all that step in the middle, and why have all the cost to the healthcare system? Because doctors' offices have whole teams of people who just manage prior authorization, just manage the billing, the doctor's time, the nurse's time. It's a waste of our healthcare resources.
Interesting.
I want to jump in.
Please do.
I love that you picked education and healthcare as the first two questions, because there's such an intersection between the two, and it's something that I think we as a culture need to start embracing more, where you have, this idea of, well, it's education, well, that's healthcare, and in reality, in the Venn diagram, they overlap, right? And MDH just came out with a study where half of the schools don't have a school nurse, and in many of the high free and reduced schools, the nurse is the only healthcare provider that child sees. And where you're talking, you have all these great things happening in the healthcare arena, and there's these really good things happening in the ed arena, and we have to sort of come together to address some of those needs, whether it's mental health or chronic disease management. Chronic disease management is often done by the school nurse. And when you aren't managing your chronic diseases, you're not showing up in school, right? So then we have higher absenteeism. Dental is one of the leading causes for students to not show up to school is poor dental care, right? So I love that you started with those two, because they're so intertwined, and you wouldn't always
that's
think
a
of
really important observation. I think that these things don't exist in separate silos. They're all interconnected, and ultimately they're connected to finance, that these things have to be paid for. A lot of them do. And so it's a very interesting point. Bianca, I want to ask you, there was some action in the legislature this year on protecting reproductive freedom. 2 years ago, as we all know, the U.S. Supreme Court overturned Roe versus Wade in the Dobbs decision, and basically has handed it back to the states. And despite former President Trump telling us in a national debate last night that, well, that's what the majority of people want, actually public opinion polling shows that there was over 66% support, 2/3 support for keeping Roe versus Wade. But the result of handing it back to states is that some of our neighboring states have enacted onerous burdens on women and healthcare providers. Tell us what the legislature did to protect reproductive freedom and women's health.
Well, I couldn't agree with you more in the statement that you just said, because I got to door knock, right, in the weird season, November, December, and that was one of the top things people said when I was out door knocking. This is really important to me. So as far as kind of some of the things that were done, we tried to, sorry, I'm having a bit of a brain fart right now. Can you help me out here, please?
Yeah, we did things in terms of making sure that doctors and patients who came here for medical care, for reproductive care, were protected legally.
Like somebody, say a woman from South Dakota, which has some of the most onerous restrictions, might come to the Twin Cities.
Correct, yep. And so she would not be able to be extradited, basically. We would apply Minnesota law to her. And
nor could a doctor.
Correct, exactly. And we've seen doctors relocating here. We've seen people moving here. We've seen that too with the LGBTQ plus, specifically with the transgender community, because there is so much active attack for that community nationally that we set up Minnesota. We passed it to be a trans refuge state. And now one of the things we were working on in the bonding bill was to have funding to be able to have resources for them. So I think we've also codified many more of the pieces of that were in the Constitution to be able to have them in law for reproductive freedom, so that it couldn't be overturned as easily. So we've been really working to build strong guardrails and strong protections, taking the old legislation out.
Bringing it up to date, getting rid of obsolete provisions. And as a result, Minnesota has sort of become an island, if you will, in the upper Midwest, where some of our surrounding states, North and South Dakota, Iowa, even Wisconsin, have moved forward with these restrictions that were not in place prior to the overturning of Roe versus Wade.
And in Texas, infant mortality has gone up. In others, I see that Iowa is going to a 6-week ban. A 6-week ban, you don't even know you're pregnant.
Right.
And it's essentially banning it. I was encouraged that Idaho can now consider the health of the mother, but it was just procedural. It wasn't on the policy.
Right, right.
So we are far from safe in people's right to full reproductive care.
And the premise underlying the Minnesota law and our legislature and the governor's approach is these are decisions for a woman to make with her doctor and her family and maybe her clergy. Those are her decisions, not legislators who, for the most part, you have a few physicians, I think, but most of them are not medical doctors.
Yeah, as a woman who experienced pregnancy loss, and you go to your doctor and you have deep conversations about these are what your options are. And I'm married, and I talked to my spouse, and we had deep conversations on what is it that is the best path forward, right? Because we wanted to have a baby. So it was, hey, if you go on this path, if you have a DNC, there's less risk of infection. You'll heal quicker. You can, embark on that journey to parenthood sooner. And being able to have that here in Minnesota and have the options to decide what is best for you and your family is so important, I think, to so many people.
Well, and the cynical misrepresentation and lies about people are being allowed to kill their babies after they're born by these laws. It is obscene.
That's called
The
murder,
things that are,
and we already have a statute against that.
right. I mean, these are tragic situations.
Yeah.
If someone's child isn't going to live, what are the choices? It's a tragic situation that no one would take in a cavalier way, and it just infuriates me to see people manipulating that.
Let's talk about public safety. The legislature passed some really important legislation this year on gun violence. Can you tell us what happened on that?
Well, there was a couple of bills around safe storage and straw purchasing, and I am a gun owner, right? I hunt, I own guns, I grew up around guns, so I've had people come talk to me and say, hey, you're a gun owner, why do you support these? And for me, one of the things that is really important is the safe storage bill. And I try to explain it. I focus my thoughts and work around gun legislation, what will protect kids the most. And gun violence is the number one reason kids die, right? And a lot of that has to do with improperly stored weapons. And then, AR-15s, and that's a whole nother conversation.
Right.
But, looking at what is the safest for kids and having safe storage laws is really key.
Just this week, the U.S. Surgeon General, we should mention, declared gun violence in America to be a public health crisis.
That was a good day.
I mean, that's a remarkable thing to think that, this problem has risen to this level that it's declared a public health crisis. And we should mention on the straw purchasers, we're talking here about a law to increase the penalties for people who illegally buy a weapon to give it to somebody who it's illegal for them to be in possession of a weapon. Somebody who has an outstanding court order, a felony conviction of some type. Isn't that right? Because wasn't it a straw purchase that it involved a weapon that was used to murder the 2 Burnsville police officers and a paramedic back in February?
That's exactly right, and that was the impetus to be able to pass that bill. That was, I do want to honor their memory here, just to thank their families for the service, because it was a terrible, terrible day in Burnsville. And
red flag laws are a part of this too. Yeah, to try to flag those people who should not be in possession of weapons and saying, no, we're not going to let this go through, at least legally. If they try to get weapons the other ways that are illegal, there's perhaps only so much we can do, but we ought to try to minimize the risk and protect public health and safety and protect our law enforcement people.
In the area of public safety too, I want to remind us that we did major funding in 2023, providing hundreds of millions of dollars for local units of public safety to use as they saw fit within their communities to reflect their community needs. And so real investment. We took care of the SRO, the school resource officer piece.
There was a compromise worked out on that.
Yeah, which strengthened and made more consistent the experience and the expectations for SROs in the schools statewide. So
By the way, I should tell you, we had Eagan Police Chief Roger New was on recently, and he was very happy about that compromise going through, as were other police
As
chiefs.
a former SRO.
Yeah, that's right. Before he became chief, that's correct.
Yep.
Yeah.
And everyone was at the table. That's why it worked. It was such an inclusive process with all of the stakeholders and being listened to and adjusting and tweaking until we got it right.
There's so much we could talk about, but we're getting down to our last 3 minutes or so here. But I want to ask you about something. We've talked thus far about what got done. I want to ask you about what didn't get done. And we've alluded to it earlier in the conversation. Normally, in even-numbered years, the Minnesota Legislature passes a bonding bill, or as many people call it, a construction bill, because it is to finance construction projects. And I want to ask both of you, what's your take? Why didn't a bonding bill pass this year, Bianca?
Well, we ran out of time is probably the simplest answer, but it's so much more than that. And I think, like, for me, the bonding piece, the biggest request that I had was for the Mendota Police Station, City Hall. And as a new person, I didn't really know what does that look like. Everybody said the bonding bill is going to be the last bill. It'll be the last bill. And along the way, the speaker would say, these are kind of our paths forward, and those paths went from, this to this to this to this. And you would see Liz working just tirelessly and Rep. Fooley working on it super hard. And then all of a sudden we get to the last couple of days, and then Liz can kind of share.
Yeah. Your perspective, Liz?
Yeah, it fell prey to politics. The same thing happened in 2021 and 2022 when we had bonding bills ready to go. The bonding bill requires a supermajority.
Yes.
So you
needs 60%, right?
Yes.
To pass. Yeah,
right.
Not 50 or 51%. Yeah.
So that's 11 in the House, and I think it's 5 senators, if I recall correctly. So we had good progress in the House. We had an excellent minority lead, Representative Dean Erdahl, who's retiring now, who was committed to bonding, and we had very bipartisan support on the House. The Senate wouldn't participate. Senate GOP simply would not come to meetings, the minority lead. It was impossible to get anything done.
They were kind of AWOL, it sounds like. I mean, isn't the job to legislate and to take care of the state's business and our priorities?
Yeah, and so that was very disappointing, because to me, what I want, when I'm in the majority, I want a engaged and constructive opposition. That's how we get good policy.
That's right.
That's where good bipartisan
Nobody
legislation
has a monopoly
comes from.
on good ideas.
Right. So this fell prey to that, and a lot of great work did not get done. Other people they don't just call it the construction bill, they also call it the jobs bill, because that's what it is. People do the work.
Putting people to work,
people
Minnesotans to work, and buying goods from Minnesota companies.
Yep.
Unfortunately, our time has run out. State Representative Liz Reyer, District 52A, State Representative Bianca Virnig, 52B, thank you for being our guest today on Access to Democracy. Thank you for your work on behalf of the people of Minnesota at the state legislature, and we shall stay tuned for next session.
Thank you.
Yeah, thank you.
Thank you.